Mr. Speaker, all I'm saying is the healthcare system is it. The problem is funding. But in any disease process, you look for the cause. You treat the problem, but you must find the cause. Because if you don't treat the cause or find the cause, you will have the problem again. All I'm saying is the problem here is wastage. So yes, you're treating the problem temporarily by infusion of funds today, but tomorrow you will have to infuse more and cause more stress, pain, and suffering on the Bahamian populace. That's all I'm saying. At the outset of my contribution, I wish to make it abundantly clear that a fundamental tenet of the free national movement is that it is a basic human right that every citizen has easy access to affordable and adequate health care. Essential to the realization of this goal, however, is the promotion of healthy lifestyle and the expansion of preventative health care. Mr. Speaker, we are resolute in our belief that finance should never, ever be an obstacle to quality health care for all, regardless of background, economic, social, or political station in life. We believe, however, that in order to provide the greatest good to the greatest number of our people, that care must be taken as to how the program is implemented. It's essential, Mr. Speaker, that we implement our program very carefully and properly, so as the people would have the greatest benefit. Mr. Speaker, contrary to what members of opposite may think or say, the records would show that successive governments, beginning with the UBP, followed by the PLP, and continued by the FNM, have all supported, promoted, and provided free medical care for Bahamians of all our health services. At every health service, Mr. Speaker, health care has been provided by all political organizations. Free medical care has always been provided to individuals who are 65 years or over, school-aged children, police and prison officers and staff, civil servants, emergency care, pregnant women, the poor and indigent. The Free National Movement, Mr. Speaker, has always supported a national health plan. But we've always argued that no plan will succeed unless all stakeholders, the insurance industry, the medical community, and health providers are in lockstep with the plan that is implemented. I'm not sure, Mr. Speaker, I am not convinced that we have arrived at that stage at this given time. On the march to comprehensive health insurance, the Free National Movement improved our health infrastructure by, 1, constructing health clinics and mini hospitals throughout the Bahamas, New Providence, and our family islands. And most recently, Abaco and Exuma are mini hospitals, and Abaco still await the opening of the mini facility. Commenced the construction of PMH critical care block with 6 operating theaters, intensive care unit facilities, neonatal care facilities. But Mr. Speaker, most importantly, the facility provides first world technology so that if a physician or surgeon is operating and he's unsure or needs a second opinion, the technology provided to one of the other first world countries, be it the US or Canada. But such facilities, first world technology is now being provided both in New Providence and in Grand Bahama. Constructing state-of-the-art operating theaters at the Rand Memorial Hospital, Mr. Speaker, and I'm happy to say again that the Rand Memorial Hospital has the same capability of that in New Providence. Patients at the Rand Memorial Hospital who are being operated upon seeking second opinion can have that in real time while being operated by surgeons in New Providence or throughout the world. That's what a caring FNM has done in preparing us for tomorrow. We were responsible for opening the oncology center in the Princess Margaret Hospital. We substantially upgraded the Rand Memorial Hospital in Grand Bahama and the Princess Margaret Hospital here in New Providence. We introduced telemedicine facilities, and our prescription drug program is providing free drug medical services to thousands of Bahamians who are suffering from lifestyle diseases. Mr. Speaker, we welcome the fact that this government has finally brought this piece of legislation, which when enacted, will provide insurance coverage for primary care for our population. However, Mr. Speaker, we must point out our great disappointment that this bill is deficient in many ways. But most importantly, the bill fails to, one, address the important question of what a comprehensive national health insurance plan for the Bahamas will cost. Two, it fails to address the real problem that the majority of our population faces. That is, the bill does not address, it does not provide insurance coverage for instances of catastrophic illnesses. While we were moving with our program, they hired you because they thought they were getting better. But God, they want to get rid of you now. They know they've made a mistake. Now,
done that for a long time.
No, I'm just responding. He gave the speech.
He's replying to the point of order.
I want to respond. Very good understanding. That if a patient comes with a problem, you try to deal with the problem. And you then introduce the preventative to ensure that they don't come back. That's basic medical care. All I'm saying, so many Bahamians suffer from catastrophic, that has to be dealt with. That should be first and foremost. After which, what the members speak about. Have no problem, it's a matter of implementation. That's basic medical knowledge that he obtained while in medical school. If it changed, please inform. Mr. Speaker, all I'm saying is the healthcare system is it. The problem is funding. But in any disease process, you look for the cause. You treat the problem, but you must find the cause. Because if you don't treat the cause or find the cause, you will have the problem again. All I'm saying is the problem here is wastage. So yes, you're treating the problem temporarily by infusion of funds today, but tomorrow you will have to infuse more and cause more stress, pain, and suffering on the Bahamian populace. That's all I'm saying. Address, it does not provide insurance coverage for instances of catastrophic illnesses, which is very important, Mr. Speaker. Mr. Speaker, the opposite side went at great length to spread the propaganda that at long last, this bill will stop the need for cookouts and sponsor sheets to assist in defraying medical expenses, but nothing is further from the truth. Bahamians rely on cookouts and sponsor sheets to assist with medical expenses as a result of catastrophic illnesses such as cancer, heart diseases, liver diseases, and not primary care. So this will not stop the catastrophic. I want to remind the member who used to be one of my teachers, and I learned well. Unfortunately, you forgot. First of all, Mr. Speaker, primary health care is offered today. It is offered today. Second, one size does not fit all. And third, your government sold the Bahamian people a bill of national health insurance, assuring them, emotionally and otherwise, that there will be no more cookouts. Because what the Prime Minister has said, and I hope the Bahamian people are listening, what he has said is don't take them serious what they say on the political platform. Thank you very much. It's very difficult to put cost on life, one. And two, this is a very, very interesting debate. What I see here today, Mr. Speaker, is a debate on emotions and eloquence, where it says facts and action. But, Mr. Speaker, I still say the FNM feels that catastrophic is the proper way to go.